Check out this week's Stay Current Short. Peutz-Jeghers syndrome is a slightly less common pathology, affecting 1 in 200,000 live births annually, with a mutation in STK11. This syndrome has a characteristic buzzword and phenotype. It's mucocutaneous lesions.
Predominant lesions that you'll notice on their exam are their mucocutaneous lesions, and I'll show you some pictures. But they have developed GI hamartomatous polyps in the small bowel, often more so than in the colon. And a third of the patients will have symptoms from the polyps before 10 years of age. And 50% will have symptoms before 20 years of age. And again, those symptoms, as you'd expect, are pain, bleeding, obstruction, anemia, intussusception.
That's Dr. Joseph Palermo. He's a pediatric gastroenterologist and a member of the multidisciplinary polyposis team at Cincinnati Children's Hospital. While the symptoms are from a GI source, the cancer risk can be outside the GI tract, and the lifetime risk is up to 90%. So screening for GI and extraintestinal cancers starts around 3 to 5 years old.
And as I said, they get lots of tumors outside the GI tract. I think the one I've seen most often in pediatrics are their Sertoli cell tumors. And I've had a couple kids who've had those. But patients get older, obviously they have to have screening for breast, ovarian, pancreatic tumors as well. Lung, there's no specific screening, but we do know they're at increased risk for lung cancer, so they're counseled not to smoke.
Check out the full episode on YouTube, the StayCurrent app, or SoundCloud. Find the links below.